All right. These are late hours, and I've decided to just do a podcast with my mom. Welcome to the podcast, mommy.
Thank you.
So awesome. I just want you to just introduce what you do, your work, and if you want to go into detail, you can even go to detail in terms of the work that you do.
Okay. Actually, I'm a specialized operating theatre person, SNS. Then I'm a professional nurse in theatre. I obtained my degree, Bachelor of Science. Then I'm specialized in operating theatre. So for now, I'm working as an acting operating manager. Then I control all the groups, the team leaders. Then I'm available to all the groups.
Yeah.
So what I do as a specialized in operating theatre nurse, I'm able to scrub for all different procedures, the major ones and the minor ones.
Okay.
And on that turf, and continue to do management.
So when you say scrubbing, what does that mean?
Scrubbing is to assist the doctors in theatre table, helping the patients in different cases, surgery.
So maybe let's start in the beginning, right? When you were looking for a job, or when you started working as a nurse, what was the most shocking thing for you, or what was the most interesting for you in being a nurse? Did you start in the theater, or was it something where you just started as a general nurse? And how was the training like as well?
Okay, I started as a people nurse, which after training was a staff nurse.
Okay, so what's the difference between the two, the people nurse and the staff nurse?
Training as a people nurse, you become a staff nurse after training.
And then what do you do?
And I wear white epaulets.
Okay.
After 2 years.
The epaulets is those things that you put on your
distinguished devices.
Oh, okay, I see.
Then I worked as a staff nurse for 9 years because the government they used to delay to train people to further their own studies.
Oh, their studies, okay.
Then after 9 years, then I was taken as a best student and do general nursing.
Okay.
Which it was called by then bridging course. Yes. Then I trained for 2 years and become a registered nurse, a sister.
Yeah.
They call it a sister, a professional nurse.
Okay.
Then I work as a professional nurse, but by then, as a professional nurse, they didn't delay us to train further. Then after 2 years, I was trained as a student midwife. Midwife.
Okay.
Then I did it.
And then you became a sister after a staff nurse. You became a sister because of the training, and then you got another training to become a midwife.
A double qualified professional nurse.
Oh, I see.
After I've obtained my diploma in midwifery.
And then as a sister, what are you doing? What kind of work are you doing? And which
professional
wards?
nurse or as a sister, in all the wards, you are expected to manage the ward.
Okay.
Human resource, the subordinate colleagues. Then you have to manage patients.
Okay.
The patient is your first priority.
Okay. Okay.
And you manage, you carry orders from the doctor's order. Then you advocate for the patient because of the knowledge you have to advocate for the patient. When the doctor has ordered maybe another medication which you see that it will be too strong for that
for the patient,
patient, then you talk to you advocate for the patient, you liaison with your doctor, and you suggest things and give some advices. But it depends on your experience. Experience is the good teacher.
So which means you also have to know the medications which are going to be given.
As a professional nurse, you have to know anatomy and physiology thoroughly.
Okay.
Then you have to know the GNS, general nursing science.
Okay.
Then you have to know the complications which can be caused by certain treatments. You have to know all the medications, their action, their complications,
the side effects.
Side effects.
Okay.
Yeah, it's what we have to know so that it will be beneficial for the patient.
And then now, from there, being a sister, then you become a midwife. I've always heard people talking about midwife, but I'm not too sure. I know it has to do with giving birth and all those other stuff. But what do you do now? And the training, first of all, the training that you're doing, and what are you doing as a midwife?
As a midwife, you are expected to help the pregnant woman, while carrying the child. So which means you are dealing with 2 cases at a go.
Okay.
You do take care of the unborn baby.
Yes.
And the mother. You manage them until she gives birth to a healthier baby. So it is in that double qualified professional nurse for the benefit of those 2 people.
Okay.
Then that is our concern or our focus as double qualified professional nurses.
So in terms of experience that you have had there, how is it like being a midwife? Maybe if you were to tell maybe a story of how
to be a midwife is very much interesting.
Okay.
You are just working like a God's hand, because now you are there for that beginning of the fetus. Because now you are knowledgeable because you have been trained. You are knowledgeable to assist that mother so that until she gives birth to a healthier child. And you have to be very much vigilant when you are dealing with a pregnant woman.
Yeah.
And you are expected to be knowledgeable.
Yeah.
And use those skills for the benefit of the patient. And you have to know that you are dealing with two lives there.
Okay.
The baby and the mother.
Mm-hmm.
Yeah.
I'm going to come to the part of natural birth and the C-sections, right? But I've heard that most of the time when teenagers are giving birth, nurses, they like shouting at the young children.
Oh, those teenagers.
Yes. So have you encountered that, or how does it work?
Yeah.
Yeah.
Then, although personally, I'm not somebody who can shout, but when it comes to midwifery department,
okay,
people, they can feel alright. No, this lady, she has changed because I want to save the baby.
Okay.
Because normally, giving birth to a baby is a challenge. It was said
even in the
Bible
yes,
she will labor
in pain. Yeah.
But and deliver a child. After delivering the child, she usually forget that pain. God just gave us this joy, which you cannot explain it, which is beyond the comprehend, beyond your understanding.
Yeah.
I was in pain.
Yeah.
Thinking it's better to die. But no, the child is there.
Yeah.
And that thing, everything just
goes away.
It's wiped away.
Yeah.
And this joy of having a baby. Some, they end up saying, no, I won't come back. Because I know I nearly died. What? But the ones who within 1 year, they're back again.
You know what I've today. I know you're not technologically savvy, but there's an app called Twitter. It's like Facebook. So today they were asking a question: which one is worse, contractions or actually giving birth?
Oh, contraction, yeah, that's the best. Oh, contraction, it brings a princess down to earth.
Sure.
And comply.
Yeah. So you're saying that contractions are the ones which are the worst? Because when I was actually reading the tweets, they were saying the same thing, that contractions are the worst.
Contractions.
Yeah. So which means that for those who are going to be future mothers, just be prepared. You can never be prepared for them, right?
You just prepare yourself psychologically to accept there's that pain. They said there's a pain which you cannot explain it. It will be there. Yeah, that is a process. Okay, and there's no way you can dodge it and do in another way around.
Yeah,
that pain is natural.
And then in terms of the giving birth, which one is the best way to give birth? I know there's several. I only know 3, but probably there might be different ones. I know there's water birth, and there's C-section, and there's natural birth.
So water birth is a normal birth.
Okay.
It's only that when you are in that water, it releases some pain. It massages you because that water is warm.
Okay. Yeah. So that means, would you recommend people to use the water bath or?
Yeah, it's said it is nice.
Oh, okay. And then the natural bath?
Natural bath, naturally, you cannot predict it.
Yeah.
You cannot explain it, but natural bath, most of the women, they prefer to give a natural bath rather than to go to cesarean section, just to give themselves the confidence that no, I just gave birth to my baby,
own child. Yes.
Following all the instruction, although the pain was unbearable, but I managed.
Given to bed.
I managed. Yes.
And then I've heard most people saying that it seems like there's a trend these days of hospitals or private hospitals no longer wanting to do natural birth. Is it something that they're actually doing, or is it because they say that C-section has more money apparently? To do it?
So when it comes to private doctors, they always go for cesarean section because they are looking for money.
Oh, I see.
Money.
Yes.
But they don't promote a lot of delivery normally. That is the error, or that is the challenge to private doctors, most of them, especially the obs and gyne specialists.
Okay. Sure.
They like doing Caesar, although it was not necessary, because doing Caesar unnecessarily, it limits you to go further and have more children.
Yes.
When you do Caesar for the first time, then there's the possibility that you only have 3 children.
Oh, I see.
Yeah.
So with
but
that,
it is a condition of the mother.
Yeah. I just want you to now explain this before we move on to the next topic, right? Which is, let's say maybe someone is stranded, right, with his pregnant wife, and she's like literally about to give birth. Can you please maybe advise the person how to successfully give birth as someone who is a midwife? Maybe all the steps, you can just go through all the steps.
The steps, there are many books. There's this other books, Women, what. Then she can read those.
It's called what?
Women. Those magazines are Pregnant Woman.
Oh, okay.
And there's another book which we also used in our time. The 2 books there. But for now, there's some new release of preparing.
Yes. So I just want you to explain. Let's say if right now my wife is about to deliver, but we're stranded. We can't go to what do you call this? To the
private.
To the hospital to deliver the child. Like, what is the best thing to do? Maybe to explain in terms of how do I help her to give birth.
That it will be an emergency. Because labor pains, it is a process. There's no way if the mother happens to deliver a baby at home, assisted by the husband. No, that woman is stubborn.
Okay.
Because that process, it won't let you deliver at home.
But there's stories the way people are saying that they've delivered in the car, whether it be on the way.
Because they've delayed.
Oh, okay.
Since it can start by having a show. The woman can have a show. A show is just a substance which can be observed without any pain. Then that person must just go straight to the hospital for verification, or she started to have labor pains. Slowly but sure, she cannot deliver there and there. No.
I'm just giving a hypothetical scenario where something like that happens, and probably she didn't go to the hospital on time or whatever. What am I supposed to do?
You have to prepare. You take a blanket.
Okay.
And to let her lay down, maybe even the plastic, because there's a lot of blood and a gush of blood of water.
Okay.
Delivery is a dirty procedure, because sometimes you will find your first twin may come. First twin is she may defecate first, then comes the baby.
Oh, okay. Yeah.
So delivery area, it's a mess.
Oh, okay. I feel like you're moving very fast. So you're saying that let's say
then it's better
if
to
I'm in the house, right?
Yeah, in the house.
That means I have to probably use the bed.
Yes, or you just prepare
on the floor. Okay.
It will be easy for you even to clean up the mess.
Okay, sure.
But because what if the blood is a lot and you've just prepared a plastic which is small?
Yeah.
So you are going to mess up the bed.
The bed, yes.
And it will be a lot of work.
Okay.
So you prepare down, then you place the pillows like she's squattering.
I see. Okay.
In a position, then she must open her legs. Then you.
So do I stand in front or at the back? Since she's squatting.
Because you will be alone, there will be no a person. Then which means you put the pillows on the back. Then she must be just like sitting, but not sitting.
Oh yeah, so means you put more pillows at the back.
She must, because when she has got she is in semi-fowler's position, it helps her to push the baby with ease.
Okay.
To apply that pressure.
Sure. Okay.
Then
so which means
you
the position
will be
is very
there
much,
to.
So which means the position is very much important of how when you're delivering. Okay. So
rather than to lie flat.
Oh, I see.
She won't push.
It won't work properly.
Because when the woman giving birth to a baby, she have to. She lean forward to make that pressure.
Oh, I see. Of pushing, yes.
Yeah.
Okay. And then, when that is happening, let's say maybe you realize that we have sorted out the cushions, and she's sitting normally. And how do you now accept the head, the baby?
Then you go in front of her. She have to open the legs.
Yeah.
And pull and pull the lower legs behind.
Yes.
And open the legs. Then it's then that she will deliver nicely.
Yeah.
But it depends on the size of the baby or the weight of the baby.
Okay.
If the baby is too big, which means she's going to be tear.
Oh, okay. Is that
because you are not a midwife where you support the perineum.
Okay.
So we as midwife, we support the perineum when the head is approaching us. Then when you see crowning. Crowning. Then when you see that the perineum now is too shiny, which means it will tear. So then you use the episiotomy scissor. to cut
Okay.
and help.
And then isn't that painful for ladies?
No, for that moment, she won't feel the pain of
the Caesar.
Yeah, no.
And you don't even need anesthetics to
No,
feel the pain.
no.
Oh, I see.
Yeah. But to those who are preparing, they can use in local injection.
Oh, okay, sure.
And cut.
Okay.
The area.
So, which means you're now getting ready to receive the child. So, you said the perineum and tearing, right? So let's just say for what's the word that I'm looking for? That doesn't happen, and you see the crowning. How do you now? Does the child just come out, or do you just you have to
natural? It's natural. The child will come out if the passenger and the passage they are roomy enough for the passenger to
go out.
Yeah.
Okay.
Yeah.
So
it becomes a problem when the passenger has no enough space
to come out.
Yeah.
Oh, okay. So let's say maybe now
those are those complications now.
I think we'll come to the complications, right? So let me I'm just gonna play out a normal giving birth procedure for a woman, right? So let's say the child is out, is coming out.
The child will crown, and the head has got its motion. She will turn nicely, and the head will come out.
Okay.
The shoulders, you'll find them coming out.
Okay.
Then until the child is birthed, then you hold the child.
Yeah.
Then you cut the cord.
Okay. Is there a length in terms of how long when you cut the cord, does it go back inside or what happens?
You cut the cord between the placenta and the baby. The placenta which was
yes. Do you actually take it out as well on the same day?
Same time.
Oh, okay. So you pull it out.
It will depend because first is the baby, then you cut the cord.
The cord, okay.
Then you put the baby aside.
Yes.
But the cord should be tied.
Oh, okay. Okay. What do they tie it? Because I always see it. Sometimes they even use pegs.
Yes.
Why do they do that?
To control the blood bleeding.
Oh,
because
okay.
if you can just leave it, the child can bleed to death.
Oh, okay. Because that's still part of the child. Okay. And then when you cut the cord, is it far or do you cut close to the?
Maybe 5 centimeters.
Or 5 centimeters.
5 centimeters to 6.
Away from the child. Oh, okay.
Then you use the pegs. Then you put the baby. You wipe the baby. You wrap the baby.
You once told me that other nurses don't like wiping the child. They just give the child as they.
Firstly, when the child is born, they take the child before wiping and put the baby on top of the mother here.
Oh, I see. Yes.
For bonding.
For bonding, yes. Yes.
Then they take the child and wipe.
Oh, okay. So which means the first thing that you do is after giving birth, you give it to child.
They take the baby and put the.
And I saw that they also do it for husbands as well. To bond. So that's for bonding with
the husband will cut the cord.
Oh, okay. But I've seen guys doing that as well, the bonding thing. Okay.
It depends on how the setup.
Probably private hospitals
and
other stuff. Okay. And then Sounds like it's a very
Then
simple.
after the birth of the baby, it's then
Mm.
that you, while the mother maintaining the position,
Yeah.
then that you'll ask the mother to push the placenta out.
Okay.
Yeah.
Yeah. So she has to push it out. You don't pull it out.
It depends,
Mm.
but some others you just rub the
womb.
the
Tummy.
stomach,
Yes.
and you press a little bit, you'll find it comes nicely.
Out. Nice. It's so interesting. And then
You put it aside in a kidney dish or whatever.
yeah. We're gonna get to the complications. Like, what are the normal complications that you actually find?
The most of the complications,
Oh, guys, we're actually recording so late. I've made my mother to do the podcast so late. That's why she's yawning. Yeah, but you are still explaining that the complications.
Oh, the complications are many, but
the major ones that you
the major
see.
ones is when the pelvic floor is not normal. We've got different types of pelvis.
Pelvis is this thing of the hip bones.
Yeah.
Oh, okay. So
that it determines that the woman will be able to give birth.
Okay. And then how do you know?
That if for now I cannot say much because I've forgotten those names.
Oh, okay, sure.
Different pelvis.
Oh, so that means you just know that, okay, this one is this type, this one is this type, this one is this type.
On examination,
yes,
it's then that you identify it, or this one she won't give birth.
Oh, I see. Makes
then
sense.
You call the doctor to confirm that, which means she will go straight for cis.
Okay, so now you do your profession. Is it being a sister and double qualification as a midwife?
A midwife.
So after that, what is the next thing?
You go for specialist.
Oh, okay. So
to
which is the
the departments which you like.
So what specialty do you do in? Which one did you do?
Myself, I did the operating theatre.
So all this time, so when you're a sister, you're not working in the theatre. Are you working in the theatre, or you're just a sister who's working generally?
I'm working in theatre because most of the time I was allocated in theatre.
In theatre, okay. And then that means...
And that's why I end up very much interested to go for specialty.
Yeah.
But I've worked all the general wards.
Oh, okay.
Medical ward, surgical wards.
Okay.
Peds.
What's peds?
Then as a double qualified midwife.
Yeah.
I worked also in maternity. And in casualty, OPD, all this discipline.
Sure.
I can work as a professional nurse.
Okay.
But now, because I've been trained, I was interested in theatre.
Sure.
Then I went
for theatre, the theatre one. Okay. And then how was it like doing the studies and getting to do theatre?
During while I was doing theatre tech, I had a challenge because of the management. I first went to Garangua Hospital and trained there for 6 months. Then I was called back.
Okay.
Then that was an experience which was not nice.
Yeah.
Then after 5 years, it's then that they do also continue or do you still, are you still interested?
Yeah, sure.
Then I said yes.
Mm-hmm.
Then I went to school for specialty in Petersburg Hospital, Limpopo College of nursing. So I did my training, but I didn't come upright in IMS, internal medicine.
Okay.
It was a challenge to me.
Okay.
Then I came back. Then because of the period we are given as government student, we are given a period to finish.
Mm-hmm.
So I failed.
Yeah.
Then after that year, I switched. After 2 years, I switched to further my studies to complete the theatre tech in Pretoria University.
Yes.
It's where now I've obtained my diploma.
Nice. Congratulations.
Although it was a long journey, for me it was challenging.
Yeah.
But I end up having what I wanted to have.
And then I want you to, since you're the older generation of nurses, what is the difference between, because you work also with students who are growing up, what is the difference between the attitude between your old nurses and the new nurses that are coming in now?
The old nurses, they easily comply with the principles, and they maintain their basics. But these new nurses, because most of them, they came to nursing as a profession, not as a call. But the old ones, most of them, they focus that it's a call, because nursing is very much a difficult career altogether. Because you are dealing with people, dealing with human is very much difficult. It needs grace, it needs God to assist you, because you just go beyond and try to meet the needs of that patient.
So when you say that the new nurses, I'm sure it's not all of them, but from your observation, you're saying that the new ones, they are more professional instead of seeing it as a calling. What are the things that they do which you would advise as someone who's saying that you're a part of the old school who do it as a calling? What can you advise them to start doing?
They must tell themselves, or they're dealing with a human being, and a human being is next to God, and they have to be faithful to themselves. Or are they doing justice to this poor patient? Because those patients are there for us. If they don't come, there's no work. So they come because they need our help. So if you take it as a profession, it's then that when those patients call for help, you will just pass, just say, when we dinner bad. Badina. But one never wanna board.
And so you get those stories as well, that nurses sometimes they don't like doing that. They always
but they are been employed to do that. You see, they have to be faithful to themselves.
So which means that the difference from what you're saying is they should have a heart for people, and they should have compassion as well, and a willing heart to actually help the patients as well.
That is very much important. Nursing is not an ordinary career. It's a call.
And then now you are working as an what did you say?
OPM.
OPM.
Acting
OPM. What has been the difference? Because now you are growing in your career and you get to a point where you're acting OPM. What is the difference between, because we move from midwife to qualifying,
especially
specializing,
operating theatre.
We didn't actually talk about specializing. What do you do as a specialized operating? What do you do?
Theatre nurse.
Yes.
We focus. I focus on the surgeries.
Okay.
For me, I have to have knowledge of anatomy and physiology there.
Okay.
Where you work things, internal things of the patients.
Yeah.
So you work in hand with the doctors, where sometimes you can suggest and advise in some areas, especially to the ComServe doctors, intern doctors, because of the experience which you have, and the knowledge which you have. So it is very much helpful,
and then
to be knowledgeable.
And then the ComServe doctors, or doctors in general, what kind of a relationship that you guys have? And I know you said that you help them. In terms of, I'm asking this question in terms of, have you got to a point where you're working and you lose a life on the table? I don't know if you're allowed to talk about that, but if you are, how was that like, and how does it affect you?
It is stressful. It's very much stressful, because you will deal with that patient to resuscitate that patient when that patient is crushed. Then you will do whatever it takes to regain that person.
Sure. And that's because of complications that are happening as you're operating. Okay. And then what was the worst time something like that happened for you?
The worst time is when, after you find, or you've spent a lot of time doing this and this and this to help that patient to survive, but at the end of the day, that patient demised.
What is demised?
Demised is passed on.
Okay.
Then it's very much painful.
And then how do you deal with that?
It's stressful. And it needs counseling also.
Okay. Have you ever went to counseling yourself?
No, I don't have counselors. By then, they were not having those counselors. Only the managers, they used to talk to us.
Oh, okay.
Counsel us, but it's a very bad experience.
And you can never get used to it?
No, you cannot.
Because the reason I'm asking that is because people like paramedics, with them, it's like they see death. I'm sure they see death almost every time.
Yeah, those ones,
with them,
they need counseling nearly on every month. Aye.
Yeah.
Those ones.
Yeah.
I know.
Hectic stuff.
It's tough, very tough.
So which means for you guys it's a bit light. It doesn't happen all the time because you guys are actually people who save lives. Okay.
During our training, there's this statement for operating theatre that we've got few seconds
to resuscitate,
to gain our patient, or we've got a few seconds to lose. Yeah. That's
So we just
our
have to
norm.
be very careful when you're
Yeah.
doing that work. I think that's the reason why I didn't want to become a doctor. I know in our family, everyone is like you and dad. You're in the nursing, the health department. But I realized that responsibility is actually a lot.
Yeah, a lot.
Yeah, so I was like, okay, you know what? I can't really be in the health department because I actually wanted to be a doctor. But I was like, no, I can't deal with this one. Yeah, so
A doctor is it's a calling also, and you have to be 24/7 up.
Always ready.
You're always ready to help.
Wow.
Whether you are in a party, you are on the road to doing 1, 2, 3. But
do you get like maybe a doctor who comes there would not, I don't want to use the word drunk, but who's maybe compromised?
this now doctors of today, oh, that have some they drink.
Yeah.
Then when they are on call, you know, hey, this one it would be a problem.
And then but some of them, they actually know how to do their job, so they actually help even though they're a bit drunk, but they still do their job. Yeah, it's interesting. It's very interesting. Okay, I don't want to make this too long because you're still going to work tomorrow.
Yeah.
But I think one of the things that I just want to touch a bit on family. What are the few things that you would want to, if there's a message that you want your great grandchildren to hear? What would be those words? Or maybe advising young girls. Maybe start with advising young girls, and we come with advising young boys who are going to be listening to this podcast, saying that this is the voice of our grandmother.
Inside me, or what is my desire, even while I was growing, was to please my parents and have a listening ear to my parents, because I knew Uri, my parents cannot direct me in a wrong way. They cannot rob me even for my future. Ne? Then secondly, as a young lady, you have to love yourself, and it helps that the enemy mustn't vandalize your future so easily, because the enemy is very much jealous of you. He doesn't love us. So as a young woman, you have to love yourself. If you love yourself and love God, then you have started in a right way. Then you will be protected. And don't allow friends to dominate you with other stuff, ideas. Like things like that. Because those things, some they can do it with jealous of you.
Okay.
Then you find that at the end of the day, your future is tempered permanently.
True.
Where you cannot reverse. There are some things which you cannot reverse.
Some you can come back, some things you can't come back from. And then for boys, Boy grandchildren.
Boys also, I can advise Uri. I value boys also to focus on virginity. Not boys to be let freely
promiscuous, yeah.
You see, as if it's only girls who are supposed to maintain their virginity. No, even boys. And the boys must be taught responsibility. It helps in their future.
Yeah.
Or they are not spoiled, and they will treat their wife nicely. And a basic love is the source. It's a good source of life.
Yeah.
Love. Just to love somebody unconditionally. And don't compare that person with anybody, because no one is like anybody. And that respect. This young women and young men, they must learn to continue with respect. If they respect their mothers and fathers, they must also respect any mother outside there in the road, and any father outside there. It will help them to grow spiritually, to grow and to be protected, because God also valued that respect of the elderly. Not I respect because she's my mother. No, you respect every mother as a mother.
And then maybe in conclusion, I know this is I wanted to do one just I wanted this podcast to actually to also talk about family as well, but I'm realizing that we won't have that opportunity. But I think what you just said now, it's more than enough, so that at least your great children, when they listen to the podcast, they become blessed and say, this is what our grandmother left us with. This is what she told us, that we must do this, we must do this, we must do this. And then becomes some form of a legacy that they stay with.
They must respect life.
Yes. Yes. So maybe the last thing, maybe, because since this podcast is more professional wise, what can you advise? I know I've asked this question. What can you advise young people or young nurses out there to become better nurses? What can they do? What should they focus on? I know you've touched a little bit on it, but maybe just in closing, just what can they do?
What they can do, firstly they must be faithful to themselves, because they've been taught all the principles, professionalism, and all these things. All the basics are there when they start their nursing. So they must maintain that standard and continue going with those standards. And respect a human being, because they are dealing with God there. Each and every human being is God inside. And it will help them if they respect that a person. It will help them to value what God expects from them, is to value another person, and they will use their skills and knowledge, and they will be able to put them into practice with honesty, faithfulness, and honesty. That is the key, and truthful. to speak the truth. We don't bribe the patients. We don't brush them by telling them lies. We have to be truthful. And speak the truth. It's something like that.
All right. Thank you, Mommy. Yeah, I think just go and get some rest. Yeah, but thank you so much for honoring the podcast. And for those who are nurses and wanting to be nurses, I think they're gonna also probably value so much the things that you have shared. Thank you so much. And I know we see each other once a year. Yeah, but thank you so much for this nice opportunity. So when it's online, I'll let you know so that at least you can listen to yourself as well.
Okay.
All right. Good night, Mommy, and good night to everyone else.
Good night.
Awesome.
Thanks.